All right. Well, hi everyone. My name is Kat Rudolph, and I am the state policy representative for the Iowa Academy. Thank you all so much for tuning in today's webinar. We'll go ahead and get started. Preparing for the 2023 Iowa legislative session advocacy, essential for ensuring nutritional access, equity, and security for all Iowans. For now, we please ask that everyone mute their microphones if possible. I do see a couple that are still on, if we'll just mute those for now. And then if you do feel comfortable, please introduce yourself in the chat. We really highly encourage everyone to use the chat to ask questions throughout our webinar today or make comments. We want this to be really engaging. Christy will be monitoring the chat throughout our webinar. Speakers, just a reminder to check in between your slides or between information. So Christy can share if anybody has any questions or comments that we can talk about throughout the webinar today. So with that, I would like to introduce Caitlin Sharman, the Iowa Academy of Nutrition and Dietetics Public Policy Coordinator, to get us started.
Awesome. Thanks, Kat. So on behalf of the Iowa Academy, I'd like to just briefly introduce the members of our public policy team. So our speaker today is Brittany Lumley, a lobbyist from LS2 Group in Des Moines. Lobbyists are professional advocates that work to influence the political decisions on behalf of organizations like the Iowa Academy. We've been fortunate enough to work with LS2 Group since fall of 2020, and this was a decision that was made because of our increased efforts, or because of increased efforts in the past several years to remove licensure from our profession, not only in Iowa, but across the nation. LS2 Group has a bipartisan lobbying team with years of experience at both legislative and executive branches of the state and federal government. They specialize in cultivating relationships with key policymakers and use their knowledge of how the legislative process works to influence policy decisions on issues important to their clients, like the Iowa Academy. So I will welcome Brittany to our webinar. And if you can go to the next slide, Kat, that would be great. Maybe one more. This is our team. So this is, you can see myself there as the public policy coordinator, Christy Carr, state regulatory specialist, Susie Roberts, our consumer protection liaison, and then Kat, our state policy representative. And we do have an open position on our team for the reimbursement specialist. It previously had been called nutrition services payment specialist. So you could be part of our awesome team if you wanted to. Could you go to the next, maybe one more slide? There we go. So today's objectives for our presentation, we want you to gain a broad understanding of the political landscape, especially during this 2023 legislative session. We want you to learn how to effectively and confidently speak with our legislators and to become informed of some key action steps you can take to help elevate the dietetics profession. All right, go to the next slide. There we go. So this is our leave behind for our legislators that we would use if we were having a conversation with them. So our priorities are listed on here. And this year, top priority is maintaining licensure for our profession. And if you want to hit next. Next is to ensure adequate food and equitable healthcare access. And then our last legislative priority as the Academy is to expand dietitian provided service and really leverage those training and skills and the value of registered dietitians in public, clinical, nonprofit, business, research, education, all of the different settings that we work with in both rural and urban communities. All right, and with that, I will turn it over to Brittany.
Thank you so much, Caitlin. I appreciate all of the warm welcome and the great introduction. And I'm very excited to be here speaking with you all. If there are questions, again, as Kat kicked this webinar off with, please let me know as we talk. I want to answer questions when they're top of mind, and sometimes we can get rolling, and I don't want anybody to feel like they didn't get their questions answered. So by all means, please utilize the chat, and we will answer questions as we get them. But again, I will say, kind of going back to, LS2 group, we've been working with you all for a couple of years now. It's been a great relationship. I truly believe in the mission of the Academy, and just the importance that dietitians play, and a healthy diet plays in the role of all Iowans, of everyone in the country, actually. So I'm really, really excited to represent you all. And I know I speak on behalf of our team when I say that. So the legislative session, we are off and running. During the session, you have a full team up at the Capitol, just to remind everybody, and we are up there every day that the legislators are there. Just a reminder, legislators are usually at the Capitol Monday afternoons through Thursday, and then they're back in their districts on Friday. Hence why I am back in my office right now, catching up on some administrative work, making sure we're looking at all of the different bills that have been filed, and answering questions and things like that. It's a good catch-up day for us lobbyists. So that's good. But anyways, like I said, you've got a full bipartisan team. You've got an attorney on either side of the aisle as well. And we're very well equipped to handle all of your legislative needs during session. And we are excited to do so. So we have in front of us with this slide, this is the 2023 legislative session time. It's important dates. So obviously the first date is important is January 9th. That was last 2 Mondays ago, where that kicked off the 2023 General Assembly. Iowa works off 2-year General Assembly. That's our time frame. So we kicked off, every other year you'll have an election. And so 2023 is the start of the newest General Assembly. We had Governor Reynolds giving her updates and speeches throughout last week, as well as her inauguration. We heard from the state Supreme Court. They gave an update on the state of the judiciary, as well as the defense folks to give us an update on the state's defense and all of that. So the first week is usually a lot of fanfare. There's a lot of pomp and circumstance. There's not a lot of work done, but there are a lot of bills filed, which we saw, within that first couple of days, we saw that the SNAP, the public assistance bill filed as well. But that's the first big date we will highlight. The next, the first funnel. So you'll hear about me talk about funnel deadlines, the first funnel, second funnel, something being funnel proof. This is just, these deadlines are set so that policy continues to move throughout the process in a timely manner, and the legislature doesn't get stuck on one piece of policy and it could take up all of the oxygen in the room for a long time. So this ensures, these funnel deadlines ensure that the policy bills are moving and the legislature is moving and getting their work done, so we can end session in a timely manner, which is set for April 28th. That's the last big date, I will say. Of course, we know that is by no means the drop. That doesn't mean that they actually stop working on that date. That just means that legislators will stop getting paid. So a lot of times, especially in the last couple of years, we've seen the session go for longer. And that just means they're down here, they're doing it completely unpaid. So they're paying for their housing, their food, all of that stuff. So we're hopeful that session will end on April 28th. We hope everybody can get along and get things moving. But that does not mean that's the end of the session. That's the complete end of the session. It can go longer. As for the political landscape, I don't know if we need to move slides here, but we've talked about this. We are in a Republican trifecta here in the state of Iowa and have been since 2016. In fact, it's only grown even more red. With this last election, we had the House of Representatives picked up 4 members. So they're sitting at 64 Republicans and 36 Democrats. They are just shy of supermajority. But or maybe and then on the Senate side, we are sitting at 34 Republicans, 16 Democrats. So we do have a supermajority over there. So it's very red. And obviously Governor Reynolds won re-election by double digits, nearly 20%, 20 points, which is pretty big for any governor to have won in the history of the state of Iowa. Additionally, in some other cabinet or some of her cabinet or executive branch heads, the treasurer's office flipped from Democrat to Republican, with Robbie Smith beating Mike Fitzgerald, and the Attorney General, Brenna Byrd, she beat longtime incumbent Tom Miller. So really, we're looking at a very, very red state. And the especially in the legislature, I will say the typical Republicans or the Chamber of Commerce Republicans are not the types of Republicans we're seeing. We're seeing a lot of populist based folks being elected to the legislature, which makes for an interesting discussion and interesting priorities up at the legislature this year, which we can flow right into with having these strong red strongholds in all branches of the state. We know that the priorities are school choice. That's what we're hearing about right now up at the Capitol. All things school choice, they are moving that very quickly with a debate that is scheduled for early next week already on this big priority of the governor as well as the legislature. So we'll see if that gets done. And then they will move through to workforce issues. That's a really big topic of conversation. It's a big umbrella, what that could include. But we know for sure it will include a discussion on tort reform. There's been a really big push to make some changes to non-economic damages on both the medical malpractice side of things and the commercial vehicle side of things, which not a lot of dietitian talk, but tort reform will be something you'll likely be hearing in the news soon after they work through school choice. Further, maternal health is going to be a huge issue. You know, we've talked about, there's always a discussion about the pro-life versus pro-choice. And this is going to be something that supplements the pro-life message of trying to really give services to mothers and expecting mothers in the state of Iowa. So that'll be something that they will focus on. And finally, one thing I want to put on your radar is the government reorganization, a bill that the governor wants to introduce. She wants to take her directors. We currently have, I think, 34 or 37 department heads, and she wants to consolidate that down to 16. So what that will look like remains to be seen. The bill is going to be massive, but it is something that will be huge for the state of Iowa. It will be huge for how it affects you all as dietitians, especially as a licensed profession. And we'll be keeping our eyes peeled to make sure that there's no sneaky language put into there that deals with licensure. But otherwise, outside of priority bills, we're seeing just a lot of socially conservative policies, or we're expecting a lot of socially conservative policies to take up some discussion time as well, just based again on some of the legislators that were elected to the different chambers. And I see we had a question. I will see. So what impact does having a supermajority have on passing legislation and other decisions? It's a really good question. So on the Senate side of things, having a supermajority means they can appoint people to boards and commissions a little bit easier. So in our state, with a lot of these boards and commissions, the governor will recommend somebody or nominate somebody to serve, whether it's like on the utilities board or a director for a department like of DHS. And the Senate has to vote to confirm these people for them to actually take on the job. In years past, they needed at least one Democrat vote, especially last year or the last several years. But now they don't need any Democrat support. They can, if somebody is nominated and the Senate Republicans like this person, they can go ahead and confirm them without any type of debate, any type of pushback. That's a huge piece of control that they now have, and it's completely in their hands. To the extent there would be a supermajority in both chambers, let's say a bill is passed and the governor vetoes that bill, the legislature could override a gubernatorial veto. So they technically wouldn't really need a governor to sign off on anything. Now, I don't think that that's going to happen. I don't think that that would happen. I believe that all the leaders work very well together behind closed doors. I mean, obviously there's going to be some discussion and some discord between them, but to the extent that everybody works really well together, I don't think that they would do that. But that's one of the other big things of having supermajorities. That's how it impacts legislation and just the state, the legislative process in the state. So that's a really good question.
Brittany, could I chime in as well, just for like a terminology check? I heard you say populist, and for those that just may not be familiar with those kind of terms, could you explain what that means?
Yeah, absolutely. And that's something we try to distinguish too, but when we're talking to folks. So what you have, I will say, and what you've seen in the past in Iowa, or especially within the Republican Party, and I'm going to talk pre-Trump on this, you saw a lot of people who were very much fiscal conservatives. They focused on the budget and business and making sure that there was a robust business environment through less government interference, less tax, smaller taxes, and again, just having a really healthy, balanced budget. After Trump, you see these folks that you will call them Trump Republicans, you'll call them populist Republicans. It's more of a focus on the individual side of things. That comes up, and I illustrate that through like vaccines. Vaccines, when the COVID-19 vaccine came out, you had a lot of businesses who were requiring their employees to get a vaccine. And that split the Republican Party in the sense that you had these pro-business, pro-private industry folks who are saying, we want the businesses to be able to decide what to do with their employees and how they run their business. And then you had the more populist folks who are more focused on the individuals, saying you shouldn't be putting mandates on individuals. So that's how I illustrate it. But the populist Republicans are much more focused on the individual and more of the libertarian slant of things, where it's just, don't tell me what to do, let me take care of myself. And we don't really necessarily need government interference on every aspect of our lives. So if that makes sense, that's how I like to see it. It's a very different, it's very different working with these people, but it's just the way that that politics have gone, especially since 2016, if that is helpful.
Great, thank you. I'll move on to the next slide unless there's anything else you had to say about that.
No, we will get into the we're going to talk about some key legislators. So again, you will see Republicans highlighted as the key legislators on these next two slides. That's not to say that you shouldn't be reaching out to your folks if they are Democrats. We reach out to everybody, but to the extent that they control what happens in their committees and can help move bills along quicker, that's why we have focused on these key legislators. So in the Senate, we have Waylon Brown as Commerce Chair. Anything insurance, health insurance related, whether it comes to insurance coverage or things like that, that would be seen through his committee. He's been in the Senate for quite some time, but is new to the Commerce Chair role. And he's from Northern Iowa. He's a farmer. On the state government side of things, when we talk about licensure, that would be Jason Schultz. He was former Commerce Chair. He has served in the House and has been in the Senate now for, oh my goodness, almost 10 years. No, yeah, about 10 years now. And he's out of Western Iowa. He's a farmer, extremely conservative, but also great to work with if they're concerned. So he's great to reach out to and have conversations with. He is the champion of the raw milk bill from last year. So just putting that out there. And then Senator Jeff Edler, he is from the Marshalltown area, Health and Human Services Chair. Again, we have another farming background. He's been in his role now for, I believe this is his second term as the HHS chair. So anything medically related, that's the committee that he oversees. And then we'll flip over to the House. We've got Representative Jane Bloomingdale. She shares a district with Waylon Brown, but so she's Northern Iowa. She's a retired accountant. And she's a moderate Republican. These three ladies and these three leaders in their caucus are a little bit more moderate than in the Senate, I will say. But Representative Bloomingdale will be overseeing all licensure discussions, and she already knows of our concerns. Well, all of them know of our concerns, but that she will oversee those bills that come through. Then we have Representative Shannon Lundgren. She comes from Piasta, Iowa. She's a bar and restaurant owner for the last 20 years almost. She has worked as the Health and Human Services Chair before and has been Commerce Chair for the last 2 years. Again, all insurance coverage comes through her committee. And finally, Ann Meyer, she's out of the Fort Dodge area. She is a registered nurse, and she would see all things, health and human services related when it comes to hospitals, medical decisions, all of that. So they're great. All of our chairs we have great relationships with, and the ranking members, those are the Democrats on the committees. We work with them as well, but we have great relationships with them, and they are the ones who kind of the first line of leadership. These are the 6 folks that would be, I would put that on there when we're moving policy bills. And so with that, I know that we have, I want to bring Susie into the discussion on these next couple of slides. As we get into the discussion on how to build a relationship, or what it's like building a relationship with legislators, I wanted to have Susie jump in, and I will give you the floor.
All right, thank you so much, Brittany. And just really happy to be adding a little something here to our training webinar. Actually, on January 6th of this year, I met with one of my re-elected legislators, Heather Matson, and I actually took another fellow RD, Allie Landsman, with me, and we set up a meeting at Smoky Row. And how did I do that? I literally just messaged her on Facebook, and she replied and was very interested in meeting with us. And so we met at Smoky Row and had at least an hour conversation. The way that I prepared for that, and Brittany, please feel free to add anything else in here, but I tend to like to have information with me. I like to have a piece of paper with me. And I just simply put together a little one-page outline of what I wanted to talk with her about. And one of them was my role as a dietitian, that I had been in this role for 6 years, and how I realized it is so important that we dietitians use our voice, advocate for our profession, and also talk about what we do, and just make, I guess I would call it, make more noise about the value that we provide for the health and well-being of Iowans. I also shared with her a little bit about the different professions that we registered dietitians can be in. And I also shared with her the difference between a health coach or a nutritionist or a registered dietitian nutritionist, just to give her kind of the scope of services that can be out there. And again, explaining just a little bit about the differences in the array of services and the depth of the information that registered dietitians are more educated and trained to be able to provide. And she was very appreciative of that. She also asked about, what could she do to help us? And Allie and I explained that again, we went over our handout that you all can have, that Caitlin first talked about here earlier, with the legislative priorities being maintain licensure, nutrition security, and health equity. And as we were talking with her, and Allie also helped point this out to me, she really keyed in on the words nutrition security. So that's a huge thing. And we're already seeing, a bill out there for looking at the SNAP program and verification of income and things along those lines. So it's there, it's being talked about, and we knew it would be, because it has been such a big concern. But then my next steps from there were to thank her for her time, follow up, and I also told her to be sure to, if anything nutrition comes up, to keep me in mind. And one thing I wanted Brittany you to add in here, when you think about the years of experience that you have had working at the Capitol, visiting with all the legislators, again, both sides of the aisle, would you say that they truly know what a registered dietitian does and what we're all about?
No, I mean, to be very frank, no. I think that and that's not anybody's fault. We can blame the internet. There's the difference between dietitian, nutritionist, a health coach. With social media, I mean, there is so much confusion. So I think, to your point, Susie, no, they don't, they need to know.
Mm-hmm. And I think that's one of the key things we want our legislators to know, is that we are available to be a nutrition resource for them, and can provide information, facts, figures. As a matter of fact, if anyone on the webinar here, if and when you're visiting with your legislators, if they say, well, do you have any idea about such and such data or statistics, let your public policy team know, and we will do our best to try and help you provide data. They're all about data too. That was another thing that Heather was mentioning, that it's good to have facts and figures.
One thing to add to that too, if I can, Susie, from our time meeting Heather, a couple more things that I want to mention too when meeting your legislators is, if you possibly can, if there's another individual that you could partner up with. I know that was really helpful for Susie and I, especially with dealing with nerves. But another benefit of it was Susie and I came from very different spaces within dietetics. And you never know what way, unless you've met with the individual before, what they connect with more. So Susie came from a very individual approach to nutrition, and I come from a realm of systems thinking and approaches. And that was very helpful for breaking down things, but also connecting with the way that the legislator is very comfortable with thinking and approaching things. So that is also very helpful.
Mm-hmm. And thank you so much, Allie, for talking about that. Because the other advantage of, having a fellow RD go with you, or if you have that opportunity, is while your partner is visiting with the legislator about something, you can kind of regather your thoughts, and maybe you'll think of something additional, another point that would be helpful to the conversation. But yes, and thank you, Allie, again, for bringing that up.
Thank you. I'll chime in as well now that we're talking about this, but I wonder if people wanted to reach out to our email for our policy team that we'll have at the end, and we might be able to pair and match people up that have the same legislators within their districts, so you can get a little group together for the same reasons that Allie and Susie just shared.
Mm-hmm. And if I could just add one thing here more, and then maybe Brittany could address anything that we may have forgotten. But so I live in Ankeny, and our city sends out a little Ankeny Living magazine. And in there, I was looking at the upcoming events. Of course, they've got park and rec things and, basketball tournaments, etc. But on February 10th, and Allie, I also wanted to make sure you knew this, there's a legislative day at the library on February 10th. And it's from 11:30 to 1 p.m. where anybody in, the districts in Ankeny can go to the library and visit with their legislators and be talking about the current legislative, bills and things going on. So I've already got it added in my calendar, and Allie, hopefully you can make it there too. But just wanting to let you know that in your communities or your counties, there are probably other opportunities to meet with your legislator. Maybe Brittany, could you mention about that a little bit? Because I know so much of Iowa is rural, but.
Yes, absolutely. And Susie, that's great. And that's that's the most, I will say, the most organic way to meet with your legislator, if you can quote bump into them at one of these events that they put on. I know we've had a couple of you reach out, just is there a list or something that I can send out? I will say everything is so district and county specific based off of the legislators that checking your current legislator's social media and even just finding if they have a website to find these town halls, to find these forums, which a lot of legislators do on Fridays and Saturday mornings when they're back in their district. And you can catch them afterwards and say, hey, I just want to find a time to reach out to you and maybe sit down and have a cup of coffee. That's great. But it does require a little bit of digging on your part. With that being said, I can, if you are like, hey, this is my legislator, can you let me know if there's any town halls or any forums? I can certainly look and ask myself as well. But the idea that it's very specific to the district. There's not like a list that has all of the different events. But Susie, that's a great example too of searching at those town magazines or local magazines or flyers, because they want to be accessible. They want to talk to you all. And that's a great first look as well. First place to look. And I know we've had some.
Yeah, there's a few things in the chat. Brian didn't have a question. He was just talking about messages and emails he's sent to legislators that had good response. And they do appreciate us being kind of their go-to for any dietitian questions, because it is hard for them to know everything about every profession. So them having your email anytime a question comes up is good as well. And then Anne said, is there any way our policy team can be a voice for IA&D dietitians as a whole? For example, speak with legislators outside of where they are constituent, or speak with national legislators. She doesn't have the desire to speak with any legislators, but would love to provide talking points.
I mean, I certainly, I represent you all as a whole up at the Capitol, and I'm not a constituent with most of the people I talk to. So I'm from a lobbying perspective, that's what I do. I just say everything that you all do in district, I just solidify your message up at the Hill and am an easy go-to for legislators when they're voting on bills. I know it's intimidating, and you guys have a lot of other stuff on your plate where everybody's busy, and I completely respect that. But to the extent that you can meet with your legislator back in district, that's great. Maybe, if the public policy team would want to meet with folks outside of the legislature, we can look at this for the next interim as a practice, to sit down with these some of the key legislators. If there's time to do that, we can certainly explore that. I'm speaking for your public policy team, but I understand what you're saying. And any data, even if we don't do that, send any of the data my way. I will ask. And then Susie, I'll let you go.
Yeah. I was just going to say, we on the public policy team, we really are already working on behalf of all dietitians in Iowa and all professions. And there's probably room that we can expand that as well. But also for example, in my role as consumer protection liaison, there are monthly calls from the Academy regarding licensure. And so I'm on those. I'm also on trying to be on some of the insurance reimbursement calls that are also monthly. So from that information that I learn, I share that with the public policy team. And as it's applicable, as we can, as it makes sense, we'll put that information out in the newsletter to, again, make more people aware. But we're definitely trying to speak on behalf of the entire state of dietitians. And Caitlin, do you want to add anything to that?
Yeah, I think that's all great. I think the only thing I'll add is a lot of times the message you're sharing is a little more powerful when you're in district, because you are the person voting for that person. So they want to know your perspective as their constituent. So I think sometimes the message can come across a little more powerfully if it's you as a constituent talking to the legislator versus us as an organization speaking to them, because they get lots of organizations that approach them. So I just think, yeah, the message comes across a little more powerfully.
And Lindy just added another resource for Anne and any of those wondering. Another way to engage is using action alerts to connect with federal legislators. So there is that link in the chat for you as well.
Also, for dietitians reference, we do have a tool called Telling a Transformative Story. This is literally a worksheet that has been developed by the Academy to help us, again, kind of pencil out our thoughts. And this is one thing that Heather Matson really, I think, made very clear to both Allie and myself when we visited. And she wants to know about fellow Iowans. She wants to know how we have impacted them in our jobs or in our volunteer work. That resonates with legislators and really helps to, again, show that value. But there's a whole worksheet involved with this, telling a transformative story that can help you walk through the steps of how to come up with something. And when you actually talk about it with your legislator, it'll probably only take a minute or two to go through. So it may seem daunting, but it's not really too hard to do.
And I would say too, they want to hear your story. They want to know about you. I mean, you're a voter. Well, I guess I should say, we're all Iowans. The legislators are Iowans. And so to the extent that there's that Iowa nice, it does exist. And so they want to hear about your story. They want to know why you became a dietitian, and all of that culminates into, well, then if there are any changes made to the profession, is it going to negatively impact it? And then it totally negates everything that you've worked towards. They want to know that story. It's very compelling. Data is great for certain legislators, and I think it's important to always have that at the top of mind. But to be, I think, a great conversation and a great or a successful meeting, if you will, it includes a lot of personal discussion. And I mean, not too personal, but to the extent that you can educate them through your own life story is huge. And it's something that really resonates with legislators. And it's something they remember when they're up on the Hill dealing with a host of different issues, and something comes up and I say, hey, Brittany Lumley here on behalf of the Academy. This might have an effect on a dietitian. I think, Susie Roberts. Oh yeah, I remember sitting down and having a cup of coffee with her, and she told me your story. It helps everything click together, and it's more effective in our strategies with legislation.
Mm-hmm. And I also just wanted to share, thank you so much for that, Brittany, but I wanted to share some of the details about the story that I shared with Heather. And I explained to her that in my current role, which I have been doing for the last 2 years, I've been at the Knoxville Hospital and Clinic 1 to 2 days a week, and I conduct mostly outpatient services, but I'm also covering the inpatient side as well. And I told her that one of the things that we're trying to do at Knoxville is make the primary care providers more aware of, one, what the services are that a registered dietitian can provide, but also with my insurance background that I have, I was also able to, I think, increase the comfort level with the providers that for these types of services, if I put through a referral for them to see the dietitian team at Knoxville, they will have the ability or the knowledge to explain to them, this is going to be a covered benefit. Because I can tell a patient, if they're being referred for a nutrition concern that I know is not going to be covered by insurance, we will contact that patient. We will tell them that. And we have actually created a very, very reasonable cash-based opportunity for them to consider, or we will just go over their nutrition questions on the phone. And so the good news from that educating of the primary care providers is that they now understand better about what a registered dietitian does. The other thing with the full-time dietitian there, her name is Lauren Berry. She happens to be a certified diabetes educator. Now that she has experience under her belt, she is able to have a very educated dialogue with the primary care providers. And she's helping to switch some of the patients with diabetes to be able to take less diabetes medications, trying to help improve the compliance for the individuals taking their diabetes medication. And so it's been kind of a gradual building of confidence, but I know that the providers at Knoxville are much more knowledgeable about what we do. And so I felt really good about that. And I explained that to Heather in a short perspective. And then I also told her that we are not able to see several patients because our services for various medical nutrition therapy conditions are not going to be covered by insurance. And in a lot of cases, when an individual hears, well, I have an eating disorder and I know that that's not covered by health insurance, that's a barrier. And so that was something that I was able to communicate with Heather. And, we talked a little bit about what are some things that we can do. And I shared with her that Brittany and I are starting to kind of plan out some strategy on how we can make some inroads in the insurance realm in Iowa, because it's a pretty narrow level of services that are covered. But the bottom line is that not having insurance coverage for a broader range of MNT services and nutrition education, it's a huge barrier to a lot of Iowans.
Great, Susie. Thank you so much for that example. During this part of the webinar, we'd really love to hear from everybody on this call, if you feel comfortable sharing in the chat or out loud. I think to Anne's point about us, meeting with legislators as well on the behalf of all Iowa dietitians, the more we have your stories, the more we can share your stories, in addition to ours. So even if you don't quite feel comfortable reaching out to your legislator, you can send your stories our way as well. And the more perspective that we have of Iowa dietitians, the more we can share these important messages. So like I said, at this time, we'll just spend some time kind of practicing and sharing different examples of conversation topics or stories that you might discuss with your legislators. As we've mentioned a few times so far, some examples really basic are just, what does a dietitian or a professional in your area of work do? I don't know if everybody on this call is a dietitian or not, so this might also concern like whatever your area of work is. For dietitians, what is the difference between a nutritionist and a registered dietitian? What is all the training and education that's involved and required and maintained? What are different sectors the dietitian's in? What is your sector? What are some other different wide variety of areas the dietitians work in? Those are some easy things to share. What are some of your just top 1 or 2 concerns about the legislative session? And then related to some policy priorities, why is maintaining licensure important, or whatever is kind of the thing you want to highlight when you're talking with the legislator. So we certainly have our own stories that we can share with all of you if we don't get a lot of engagement or participation, but we would love, this can just be a really casual part of the webinar if anybody wants to hop off and talk and share a little bit about their story or perspective, or working with clients in the community or patients. You can also share your story over the chat as well. So I'll just be silent for a little bit if anybody feels comfortable chiming in.
Yeah, can I jump in really quick? Sorry. Oh, did somebody else speak? Sorry.
No, go ahead.
Okay. I am working with a lot of food access in SNAP Ed. And I just saw in the chat, a lot of people were bringing up the same thing as I was going to bring up, but House File 3, I'm just interested in what, as a group, your thoughts on it, and what are the action steps you're going to take on the state level way, and also just basically walking through what are your thoughts, what are you going to do about it. And from my storytelling perspective, it's just going to be a lot of barriers for people who already are facing a lot of barriers. And I'm just really concerned about the population that I serve, especially when there's already a gap in food security within certain racial groups. And I just think it's going to really negatively impact a lot of things. So anyway, that's a lot, but just wanted to know your thoughts and other people's thoughts. Yeah.
Yes, thank you so much for that question. I'm going to ask our team or Brittany if you guys have anything to share related to that.
So it, to the extent of messaging, and I'm sorry, I didn't see who was speaking the way I have everything set up. I apologize, but to the extent of talking to your legislator, I mean, that's how I would say. I just say, I have concerns about this bill. I know you'd be like, I know you are obviously trying to meet a certain objective, but this is how I see it playing out in my day to day and the people it will affect. And just being very open and honest about it. And you know, a lot of times, again, I think people sign on to ideas, and then once the bills are put in into bill form and you kind of see exactly what that means, they don't really understand the ramifications or perhaps some of the unintended consequences. So to the extent that you sit down and have a cup of coffee with someone or are just chatting and say, hey, I understand you might be registered or you might have sponsored this bill, but this is how we see it playing out. Is there a way we can meet your objectives, but also take care of these people? I think that that's a good way to approach it. You're being honest. You're talking about something that's in their district, and also to the extent you're a resource, that you're not just bringing them a problem and then saying, "Hey, go fix it." It's like, "Hey, let's fix this together. How can we be better serve your objectives in a way that doesn't have such drastic consequences?" So I think that you teed it up just nicely. The issues that you see happening, just spell it out to them.
And if I could just add on to that, Brittany. So Brianna, when you were talking there, I heard a lot of passion in your voice. You were very passionate about that. And you were talking about the individuals, the Iowans that you serve. That's what your legislator needs to hear. They need to hear that story. They need to hear that passion.
And some of the messaging too, depending on who you're talking to, you know, this is a very emotional bill, and it affects a lot of people. And I do not want to underscore that, but to the extent that then you could maybe bring in some facts and figures as to how it would be a strain on other areas. You know, it's talking about, you know, saving money and things like that, because that's something that also resonates with legislators. So depending on who you're talking to, that can also be a way to have the discussion as well, because dollars and cents matter, especially when it comes to the state budget. So that's just something I will relay to you all as well. Sorry, and there's a ton of, I'm looking over to the chats too, so I apologize if I'm looking a little off, but.
There's another good question. Kira said, obviously voting is the ultimate accountability measure, but are there other ways to hold legislators accountable?
You know, that's a really good question. I think if having those conversations, and I don't want to say put people on record, because obviously we can change our minds, and data and lobbyists do a lot of, that's our job, is to influence legislators to change their minds, but to have a conversation and get a feeling of where they are on a certain issue, and then maybe following up if perhaps their votes don't reflect their feelings, and kind of, again, coming to a sense of, okay, well, what was your objective and why, these are some of the unintended consequences. But I think having a conversation, seeing the actions, and then following up with them is huge, not in an adversarial way at all, at least not at the beginning. And then obviously voting, I think, is the best way. And otherwise it's just making sure that your displeasure, or if you're upset, or if you're happy with your legislator, just let them know. And that might not impact the changes that you want, but at least you're having those discussions. And I think that's huge.
Yeah, I think the biggest thing, thank you guys for all those comments, but I think the biggest thing is it does, like SNAP impacts, there's a lot of research that it does impact the local economy in a positive way. And something I don't think people realize that I just wanted to mention before I hopped off this topic, but it would require only WIC approved foods, which doesn't include proteins like pork and beef. And for people like our farmers you mentioned were like huge in our representatives. So I think they don't realize that it's like, yes, maybe they see it as a priority of providing healthy foods, but at the same time, we know that proteins are some of the most expensive food items, and you're taking that off, and that will actually hurt local retailers like Fairway, who actually gets a large proportion of their profit from that SNAP money. And so I think it's just a lot of different things go into it that I think, like you said, it may just be a publicity thing for the first week, but I'm hoping certain things get out of it because financially it doesn't make sense for those that are numbers people.
Yeah, and I think this bill, we know the grocery, or I shouldn't speak on anybody's else's lobbying efforts, but I do know that this bill has caused some issues with within the grocers and the grocery industry, because of what you just said about the fact that there's no meat on that list. But so to the extent that the bill has been dropped, I believe that it was a showing again, the strong Republican values that the House is trying to push forward this year. We don't know if it's going to move. Somebody asked, when is there a public hearing or comment on House File 3? Nothing has been scheduled yet. We will let you know. You can always, I believe you can submit public comments, but until the bill moves, and I will double check on that because I always have spoken at subcommittees and things like that. I've never submitted a public comment. So we'll double check on that. But as of right now, there is nothing scheduled. And yes, but there are some very interesting and very large unintended consequences that are going to bring about an interesting group of folks to try and make changes to that bill if it sees the light of day past being filed at all. So I will say that.
These are all some really great questions and comments. I just want to point one out that was mentioned earlier about universal school meals. Any thoughts on this topic? Several states have already passed such provision. Other states are working on it. I don't know, Kaylin, if you want to chime in about that topic.
Yes, yeah, actually that was one I saw. So yes. So just a caveat first, speaking of unintended consequences, so a lot of families qualify for free school meals based upon their SNAP eligibility. So another unintended consequence potentially of that SNAP bill, if families can't be qualified for SNAP, then their children would not be able to qualify automatically for free or reduced price meals. So in regards to legislation around universal school meals, School Nutrition Association of Iowa, I do sit on that legislative committee as well, is working on a bill and getting some sponsors for that bill to provide essentially healthy, safe school meals for all at the state level. We continue to make our voice heard at the federal level, but we feel we have maybe some more traction and opportunity at the state level to actually make it happen, at least for the state of Iowa. So that is why on February 7th, if anyone is interested, you could join. We'll have some of our public policy team there, as well as School Nutrition Association of Iowa at the state capitol for our School Nutrition Association legislative breakfast. So it's an opportunity. You can invite your legislator to attend the breakfast. There will be a very nice hot grab and go breakfast served at the event. And Meg is on the call today here, and she is our legislative chair for SNA Iowa. But yeah, well, that's an opportunity you have once again to invite and interact with your legislator. And if you're passionate about school meals and you want to come share your perspective and be a support to that event, you're welcome to attend. Yes, Anne.
I just wanted to add, in case this group didn't know, But childcare centers and in-home daycare providers that participate in the child and adult care food program must also get that federal reimbursement based on the income eligibility, SNAP or FIP eligibility of the children they serve. So when you're looking at childcare providers and centers, in case you didn't know, in Iowa and across the country, that industry is struggling a ton. Rates are going up, making it too expensive for families to afford. The shortage of the workforce, the fact that our childcare providers don't get paid much, they can get paid more at McDonald's, is a factor. So when our legislators are considering something like this, they're not only hurting the vulnerable people, but also industries. Because if those industries can't get that federal reimbursement for serving healthy meals, that can really put a damper on them, and that can cause them to increase their tuition for people sending their kids to daycare. So and I know that many dietitians might not know that, so I wanted to let you know that that is the same at childcare centers that participate in that federal reimbursement program.
Yes, thank you, Anne. Yeah, I think there are lots of unintended consequences that we can definitely, and I would appreciate if you, both you, Anne and Brianna, if you have stories, information, things that you want us to be sharing with legislators, please send that to the policy email, because that will be so helpful for us to have some of those kind of boots on the ground talking points, because, you know, I'm in school nutrition, so, you know, I don't know the CACFP childcare side of the world, or the extension side of the world. So it's just really great when we have those different stories and different perspectives that we can then share with folks.
Great. Yes, thank you so much, everybody. We are getting close to the end of our webinar today, so I'm just going to go over a few kind of next steps. I think, Caitlin, exactly what you said. We are a very small policy team that's not even full and has a lot of other things going on in our life as well. So we can't do all of this alone. So if you want to send us your information, and we can kind of be a voice for you with legislators, we need as many people as possible chiming in where they can to help us to actually make broader changes. So Caitlin already shared a little bit about the Advocacy Day. We're just spending a small group from the Iowa Academy to meet with legislators, but if you are interested, especially if you're in a district of one of those key legislators we'll be meeting with, it'd be wonderful to have you. I think, like Caitlin said earlier, hearing from their constituents is a little bit more powerful than us representing. Again, reach out, follow, build connections with your legislators. I think that takes time as well. So it's probably not going to happen overnight, but just keep putting in that effort and building relationships. As Lindy shared, please, non-Academy and Academy members can complete Academy action alerts. We'll have a link. I think it's in another slide, but it'll also be in the follow-up email that you can sign up to get those action alerts. And they truly do make a difference. Those influx of messages just really spark the attention of legislators to look into something a little bit more. So please complete those. That's a really simple, easy thing. And there's a great percentage of them, people that are not completing them. So please fill those out. Additionally, we want to come up with different, easy, simple little ways for people to be involved in policy, even if you have a little bit of amount of time and energy. We do have our monthly public policy meeting calls that anybody is happy to hop onto. They're the first Thursday of the month. You can hear updates, ask questions. So just let us know. We'll send a link to that as well. For people to hop on. It's always the same Zoom link. Let's see, here's the policy email as well for you to reach out with any questions. Let us help you engage in these policy efforts. We had a lot of passion today, and so we would love to help you all get your messages across when engaging with legislators or sharing your story for you. Additionally, we still have an open position on our policy team. If you'd like to help out, we can send some more details. It's really kind of a small time position to my understanding and our team's understanding. So please reach out, even if you have a little bit to give. It's better than nothing. Look out for updates that we share throughout the session. We'll try to, even hop on to different recordings on the podcast if we're able to, and just share updates really quickly on our Iowa Academy podcast. Here's some different resources as well. We're in the middle of updating our policy page, so hopefully if you're having a hard time finding anything, I did see that mentioned a couple of times. We're trying to get that page updated. In the meantime, I do have different links, and we'll share the storytelling tool in the follow-up email as well. And then hopefully we'll have it updated on our page sooner rather than later, for it to be a little bit easier to find everything. There's an Academy Grassroots Advocacy Guidebook that has so much information and example emails and messages for you to use, and narratives. I wanted to point out as well that the Under the Golden Dome podcast, if you're not aware, does break down different things that are happening in the Iowa legislative session. That's hosted through Iowa Public Radio, so you can hop on there as well just to get updated. We do have, the Academy has a state legislative tracking map, so you can go on there, find Iowa, and it does track important legislation for us to keep on top of when it comes to nutrition policy priorities. And again, like we said, just filling out those Academy action alerts. So really want to be respectful of everybody's time. I know this is the end. We had a lot of great questions throughout. If there's anything else, we're happy to, I can stay on for a little bit longer, or hopefully our team or Brittany might be able to stay on a little bit longer if people do want to leave for questions. Otherwise, if you have to hop off the call now, please email us.
Yes, Kat, I will just add in the chat. Allie added that they are still recruiting for an IDEA public policy liaison. So that is a liaison from the Inclusion, Diversity, Equity, and Access team that sits on our policy team. So if you have an interest in IDEA and in public policy, you can kind of fulfill both roles between that role. So just wanted to share that with everyone.
Great, thank you. Does anybody have just some final last minute thoughts? If not, totally fine. I think we'd love to continue to hearing from you. We'd love to, if anybody can hop on our monthly calls to share a little bit more about these policy issues that you're concerned about. We would just love to continue the conversation.
Thank you. Do you know of any part of policy day? I can't make it that day because I have other meetings. Are you is it gonna be remote?
The February 7th Advocacy Day.
Yeah.
We will be in person at the Capitol. We will be have just a small team there, but we're hoping to take really good notes and to send out like an email update of what happens during that time. But that's also a good time to reach out to your legislators, like before and after. Just, you know, our Iowa Academy will be there at the Capitol. It's also a great time for you guys to email, reach out, set up your own meetings. Sorry, Caitlin or Susie, do you want to add anything to that?
I will. Yep. So Tina, thank you for the question. You know, coming out of COVID and then, you know, going forward, we did something new last year, and that was working very closely with Brittany on targeting specific legislators. And we had a meeting with set aside meeting times with specific ones last year, and found it very helpful and very effective. And so we've, the goal is to repeat that for this year as well. And so it's been a little different approach than what I know we've done prior.
Okay, that's
great.
great.
Yeah, because just slipping a note in, you know, during a session and hoping that our legislator will come out, you know, a lot of times they weren't able to come out. And so we're trying a different approach, and I feel like it's quite successful.
Good. Okay.
Yes.
I just didn't know, sometimes, yeah, we used to have like a little, you know, like a little session before we would go across the street. I just didn't know if that could be, you know, WebEx or whatever, but no big deal. As long as there's notes, it's fine.
Yeah, well, and see, that's what this webinar today is kind of a part of what used to be the full day of advocacy training.
Gotcha.
And so with Kat, she has come up with a new idea of kind of spreading out and having additional advocacy training webinars throughout the year. So that's kind of replacing that whole day thing, again, in the hopes to, you know, engage more dietitians as well.
Great.
Great. Any last final little minutes? We do have to probably hop off here soon, but any burning questions? All right. If not, thank you all so much. This was a really great webinar today. We really appreciate all of the engagement that we had. Just a reminder that this will be recorded. You will receive a follow-up email, and there is an evaluation survey to fill out to get your certificate if you can earn those continuing education credits. All right. Thanks, everyone. Have a good rest of your day.